This is a well-known fact. The only way someone can get help is if they want it. There are some people who need help, but don't feel they want it, aren't willing to get the help, and their life could be in jeopardy.
Regina Police Chief Evan Bray says forcing people who are addicted to drugs into treatment against their will could save lives. Bray uses the growing homeless encampment in front of Regina City Hall as an example of a situation where individuals have declined to receive help, even if it's offered to them. Involuntary detention is not a new concept, but it would be a new approach in this city.
A person is essentially not arrested for a criminal offense, but taken to a center where they're going to receive the health help that they require, but they're not leaving. They're there where they are going to be met with resources to help them and try and find a way to get them healthy.
Bray openly admits it is a controversial proposal, but he says it is something that has been raised in discussions with the province. Saskatchewan would have to introduce legislation to make this proposal a reality. On Wednesday, the provincial government would not say whether it is considering introducing involuntary treatment legislation, but did say it's monitoring efforts in other jurisdictions and will work with municipalities on addictions issues. CBC spoke to organizations that deal with addiction on a daily basis, including Prairie Harm Reduction and the John Howard Society. Both say involuntary detention isn't a solution and that everyone deserves dignity and respect.
At the root of it all is a person and is a human being, and they have to be treated like a human being, and they do have a right to choose what happens in their life.
The executive director of Prairie Harm Reduction says a better idea would be to fund services that help people with addictions, like low barrier housing, shelters, and treatment for mental health issues. Advocates say ensuring people want to get help and making the supports immediately available would be more effective in long-term recovery. Alexander Kwan, CBC News, Regina.